Welcome to our presentation about how small business employers can navigate the many parts of healthcare reform, also known as the Affordable Care Act. Over the next few minutes, you will learn how you can better handle the new laws and requirements of the Affordable Care Act. Understanding the Act and your responsibilities can save employers that offer, or would like to offer, group health insurance thousands of dollars. Beta Benefits offers this free online education program as a commitment to the success of all small businesses. For over 20 years, Beta Benefits has helped hundreds of businesses and tens of thousands of employees and individuals find the ideal health benefits within their budget, providing outstanding customer service and support. We hope you find this information helpful, and when you contact us for more help with the Affordable Care Act, we stand ready to help answer your questions and show you the value we bring to small businesses. Small business employers that offer group medical insurance need to meet a number of requirements under the Affordable Care Act. What many employers do not know is there are also key opportunities employers can use to their advantage, including the following three. Number 1. Employers must provide employees with mandated notifications of their options to join their state's individual insurance exchange or remain on their group insurance if available. Number 2. Before the end of this year, most insurance carriers are offering small businesses an advanced or early renewal option to lock in their premiums for longer than the traditional 12 months. Number 3. All small businesses should shop all available group health insurance options, as insurance carriers have become very aggressive with premium rates and health plan benefits. The Affordable Care Act does not require small business employers to provide group health insurance to their employees. In fact, many small business employers do not offer group health insurance. Employers that currently offer group health insurance may either drop their coverage without penalty or look for ways to keep the group coverage in place. Employers are required to pay a minimum of 50% of each employee's premium to comply with California state insurance law. On renewal in 2014, employers will face many changes in the benefits they can offer employees, as all health plans will only offer new metal plans. This change forces small business employers to gain a better understanding of what their health plan, benefits, and premium options are, and make decisions based on those options. Working with Beta Benefits, we can show you how to select the best health plan for you and your employees. Employers face the new issues if their employees decide the group plan is too expensive. The Act's rule is that once an employee is offered group health insurance, the employee can decline the group health plan and sign up for an individual plan on the Individual Insurance Exchange. But this employee will not receive the premium tax credit or subsidy to offset the premium cost and plan copayments. If the employer decides to discontinue offering health insurance, individuals may qualify for premium tax credits and subsidies based on their household income and could end up better off going to the state individual exchange. For example, a 40-year-old single mother of 3 kids earning $35,000 per year would pay as much as $4,000 per year, her half the premium for her group medical plan. However, if this employee went to the state exchange, she would qualify for about $7,400 in tax credits from the state to help pay the health insurance premiums. She would only get the credit if she went to the state's individual exchange to enroll into a health plan. After applying the tax credit, she would be responsible for $1,368 annually, or about $114 each month for her portion of the premium, or far less than what she would pay for a health plan through her employer. In this case, the employee is better off not on group insurance. Beta Benefits provides plan analysis for employers, and we often find the rates better when we enroll employees onto individual plans through the state's exchange. Employers are responsible for employee notices regarding the exchange and changes to flexible spending accounts. All employers are required to provide their employees with notice of the exchange by October 1st. Beta Benefits has an employee exchange notice that is available free for anyone who contacts us. When an employer changes plans they will offer during open enrollment, the new requirement is to inform employees 60 days before the change. Flexible spending accounts have been popular for years, The new requirement limits the maximum amount to $2,500 or less for flexible spending accounts. This change may make the flexible spending accounts harder for employers to justify the cost and also less popular for employees. Health reimbursement account and health savings accounts are options that can replace the flexible spending account. Contact us for any of the options outlined in this presentation. Coverage for children is not required, but only to be offered, and not for the employer to pay the premium. Advanced renewal is the term insurance carriers are using, which essentially allows an employer to move their renewal date to December this year. Why would this be a good idea? The change effectively puts off the premium rate increase longer than 12 months. All employers with group benefits currently have rates locked in for 12 months. Advanced renewal extends this 12-month rate lock through December of 2014, giving employers a delay until the end of 2014 on rate changes even if they renewed between January of 2013 and December of 2013. Beta Benefits recommends most small business employers take advantage of advanced renewal, as long as they can compare this with the cost the carrier may charge to select advanced renewal. Some carriers may require small business employers pay 10% more for this option, while other carriers may not charge the 10%. Generally, the fear is rates in 2014 will be 20% higher than 2013 rates, so if the cost to select advanced renewal is 10% or less, it probably makes sense financially, but it still pays to compare all options. The 2014 premium rate hikes are due to mandated benefits that all small employer plans are required to cover. In response to the mandated benefits insurance carriers must now offer, many carriers will raise premium rates to cover possible claims. Another consideration is that some carriers will lock out employees that are currently waived off health coverage open enrollment on December 1, 2014. You need to see in writing how your carrier handles waived employees. The opportunity for advanced renewal is closing soon. The best approach is to compare all of your options by working with Beta Benefits or your broker or agency to provide you a comparison of all of your options. The shop is set to open for quotes before the end of this year. The very first effective dates will be January 1, 2014. The number of carriers involved in the shop continues to shrink, and the quality of the benefits could be less than expected, as many of the carriers have put together reduced provider networks in order to keep premium rates down. The shop plans will be limited compared to the private market plans, and shop plans may not end up competitive. The shop does have an exclusive on the tax credits for small business employers, so employers currently qualified for these credits will need to drop their current plan and enroll on the state shop exchange. In reality, very few businesses actually qualify for these credits due to strict guidelines. Many of the carriers operating in the private market have decided to get aggressive. They are offering significantly lower rates for new groups. With this unique situation, many small business owners need to get quotes and compare with their current costs. A true comparison should include shop, quotes from all carriers for new group rates, and an analysis of the advanced renewal offer your current carrier provides. The decision, when guided by an experienced broker, should be clear to you once you have seen a complete and comprehensive comparison. Small business employers have choices when it comes to selecting where to find the best health plan. Employers should review a detailed analysis of all options before making a final decision. The process starts with collecting information about an employer's benefits and budget goals. Beta Benefits suggests small business employers get a snapshot comparison of their options by using our Benefits Compare Survey. The Beta Benefits Compare Survey is free and helps an employer in 3 ways. Number 1, the survey will clarify your greatest benefit needs. Number 2, you will be able to easily sort through the health plans available. Number 3, you can narrow down the options to a few plans and compare those plans that most closely meet your goals. The analysis includes all group health plans available in California, including plans through SHOP, as well as plans in the private market. The analysis also focuses on options to have employees go to the individual exchange, called Covered California. For employees that are not eligible for the group medical and dependents of all employees, We offer a resource to help them shop and enroll, called our Health Plan Finder service. Small business employers need to compare their options before the end of October if they want to lock in rates and benefits through most of 2014. With rates expected to increase as much as 20% next year, comparing options can save thousands of dollars. We are able to provide a comparison for employers that complete our online benefits compare survey. Go to www.aca4employers.com and complete a short survey, and we will provide you with a comparison of your options. You can always call us with your questions or email us. Thank you for taking the time to learn more about small employer options.